When I graduated medical school and started work as a doctor, I thought, yes, I finally made it. And honestly, it was something I'd been working towards for so many years. I was so proud of myself to finally start work as a doctor, but I was so nervous. And let me tell you, that first year of being a doctor was a baptism of fire. There were so many things that I didn't expect, that they didn't tell me in medical school, that I wish I had known. Hello guys, welcome back to my channel. My name's Sarah. I'm a doctor in the UK and I make videos about my life as doctor and what I get up to in my free time. The aim of this channel is to show you that it is absolutely possible to have a fulfilling life both as a doctor and outside of work. I've got loads and loads of videos about a day in the life of a doctor and what I actually get up to at work on shift as a doctor. You can follow me around the hospital and see exactly what I do in the day-to-day life of a doctor. So have a look at my vlogs and you will see all of those videos there. So the first thing that they didn't really teach us at medical school that I was very surprised about is that nothing is black and white. In medical school and in lectures you get taught the different pathologies and you get taught about different patient groups, and you expect that, oh, when I see that kind of disease, it's going to present like this, and it's going to be easy to diagnose it because you'll get this test and then that's the end of it. What I was surprised about is that you never actually see things exactly as they are in the textbooks. Patients are people. People are complicated. People have other medical conditions along with the one that they're coming into hospital for. Add into that their social circumstances and their religious beliefs and other things that might impact their health and the way that we care for them, and it's just so complex compared to how I actually expected it to be. I thought that it would be a case of you see a patient, you work out exactly what's wrong with them, you diagnose them, you treat them, we all move on. A lot of the time it's not about being exactly right, it's about taking all of the information that you have and being a bit of an investigator, asking loads of questions, really digging deep, examining patients really well, ordering the appropriate tests, and then sometimes you still don't have an answer and you're just having to treat based on your best judgment, making an educated guess, I suppose, with part of the team and with the patient involved as well. That really surprised me. I thought that things would be a little bit more black and white, but it's definitely 50 shades of grey in a non-weird way. Number 2, guys, you need to get really good at speaking on the phone if you want to be a doctor. Boy, do I spend a lot of time on the phone. We are constantly calling our colleagues in other departments, making referrals, asking for advice, calling family members and talking on the phone non-stop. The jingle for being on hold to the operator of the hospital is permanently playing in my brain. I am on the phone that much. I remember when I first got given my bleep when I was on call, which is basically a pager. We still use those. Yes, we are back in the 20th century in medicine. We still use pagers. We get the bleep and someone will page us and we have to call them back. And I remember just feeling so nervous about who on earth was on the other end of this phone and really stressing about it. But after a few weeks, you just get so used to being on the phone. There are definitely some good techniques that you can improve your phone skills and just generally talking to other professionals within healthcare. One of them is the S-bar method, which is a way of presenting a patient in a succinct and standardized way. S is for situation. You give the situation about the patient that you're particularly worried about. B is for background. Give a bit of background about why they're here, their medical history. A is for assessment, what you think has happened and what you have done about it. And R is for recommendation, asking the person on the phone for a recommendation or you making a recommendation such as, I would like you to come and see this patient. And this is a really great method because it means that we can use this standardized way of speaking to each other and talking about patients to one another. And for those of us who don't feel that confident or who are particularly introverted, it's a way of being direct without being rude. I also learned that in medicine you have to cut out a lot of the niceties when you're talking to your colleagues. It is nice to be able to ask, are you having a good shift? How are you? How's things on the ward? That kind of stuff when there's time. But when you're pushed for time and the colleague that you're speaking to on the phone is also pushed for time, you need to cut all of that niceties and just get straight to what's important, talking about the patient and getting them the help and care that they need. Number 3, this one was a huge one, and I've talked about this before in other videos. I've got a couple of videos that I think you guys will absolutely love if you enjoy this video. I've got one that's about the best things about being a doctor and the worst things about being a doctor. Definitely check that out once you finish this video. So something that surprised me about my first year of being a doctor was that I was an absolute beginner. Now that sounds stupid because yes, it was my first year of being a doctor, but you spend all of medical school working your way up and trying to prove yourself and trying to show that you're the best and trying to show that you are worthy of becoming a doctor. When you finally get to the top of medical school, you're like, yes, I've learned everything about the whole human body there is to know. Absolutely not true. But when you start work as a doctor, it's completely different. You're no longer the medical student. You are actually the doctor. You're the one holding the bleep. You're the one writing the notes. You're the one making decisions in a lot of cases, prescribing things and doing things yourself. It's very, very different from being a medical student where you are the learner and you're observing from below. In medical school, you're constantly having to prove yourself and show that you are good enough to do the job. When you start as a doctor, you don't need to do that. You're not trying to pass an exam. You're trying to get the patient's best care possible. As soon as you forget the idea of trying to prove yourself, the better. If you try and remember that you're a beginner and that it's okay to ask for help, everything will run so much smoother for you. I realised this about a few months into my first year as a doctor, and honestly, it took so much pressure off me and it made me have such a better final few months of being a doctor. I asked for a lot more help. I wasn't afraid of looking stupid and asking questions. You're at the very bottom of your career and it's okay to ask stupid questions and to look like you don't know everything because no one is expecting you to. You're not trying to pass an exam. You're just trying to do the best for your patients. And if the consultants see that you are keen and that you're learning and that you're asking questions, then they'll probably actually think the better of you rather than just trying to keep quiet and think to yourself, oh my god, I should have known that, I didn't know that, how stupid am I? Number 4, you have to get used to seeing gross stuff and dead bodies. I worked as a healthcare assistant for quite a few years before being a doctor, so seeing gross stuff wasn't really so new to me. Lots of poop, lots of vomit, lots of bodily fluids every day. Seeing dead bodies was quite a difficult one for me. You definitely get used to it, but there's just something quite unusual and eerie, and it's not something that you would do in most other jobs. Learning to certify people once they've passed away, which is to actually say, to give a doctor's sign off to say that yes, this person is no longer alive. It's a bit of a grim part of the job, but it's also weirdly kind of a privilege. You don't get to see people when they've passed away in many other careers, and truly it is a privilege to be able to care for somebody's body once they have passed away. Number 5, that everything, and I mean everything, is about the patient. Okay, they do teach you this one in medical school, and especially if you have to sit the SJT, the situational judgment test, everything is about the patient. Everything is about making sure the patient has the best care. But once you actually put this into practice as a junior doctor, you will have a really great time. Everything will be easier. Putting this into practice means letting go of your ego, working well with the team, and not always having to be right. Actually being open to learning, and like I said before, open to being a beginner and looking stupid and asking stupid questions. Teamwork is everything in medicine. Number 6, and I've left this one for last because I think this is the most important one. Let me know in the comments if you're still watching this video at this point. Having a life outside of medicine. This is so important. They do not teach you this in medical school. It's so important to not let medicine become your only thing in life. Working as a doctor is really hard and it can be completely all-consuming. We work long hours, it's a stressful job, and it can take its toll. If you don't have things that you enjoy outside of work and other things that are holding up your life, then it's very easy to get burnt out. If any of you have ever read about the 6 pillars of self-esteem, then you'll understand the idea of having various different things that hold up your self-esteem. If you only have one, and that is medicine, if something happens to that one pillar, then your whole personality and confidence and self-esteem can come crumbling down and you can feel crushed. If you need to take time off work sick, or you get burnt out, or you just fall out of love a bit with medicine, then your whole identity shifts. It's really, really key to make sure you look after yourself, nurture your relationships with your friends and your loved ones, and enjoy hobbies outside of medicine. This is what kept me from absolutely losing my mind in my first couple of years of medicine, and I'm so grateful to all my friends and family who kept me afloat during that time. And I am so glad that I had this YouTube channel as a hobby and to give me something that I was really interested in outside of work. So that's it. Those are the 6 things that I think they do not teach you in medical school. How nothing is black and white, that you need to be really good at speaking on the phone, that it's okay to be a beginner, that you have to get used to seeing gross stuff and working with dead bodies, that everything is about the patient, and remember to have a life outside of work. Guys, I hope you've enjoyed this video. Give it a thumbs up if you have, and let me know down in the comments what you would like to see in my next video. I will link those 2 videos down in the description box below, the best bits of being a doctor and the worst bits of being a doctor. I hope you enjoy them, and I'll catch you in my next video. Bye!